Mike Pence has achieved at least a partial victory in his battle with the federal government over health care reform. Washington says it will let Indiana keep its own program for the working poor for at least one more year. Our TV6 reporter Norman Cox has more on what Pence came away with.
Governor Pence has negotiated an extension of the Healthy Indiana plan as a way to expand Indiana's Medicaid program, but Democrats say it's not good enough. The feds are letting Pence keep the HIP program for one more year while negotiating what will happen in the years after that. Washington wants Indiana to join other states in using federal dollars to expand Medicaid, but Pence wants to keep HIP, which requires participants to make financial contributions, use health savings accounts, and assist in managing their own care.
I am grateful on behalf of the people of Indiana for the good faith approach that officials with the Obama administration took in dealing with the state of Indiana on this issue.
But legislative Democrats blasted the compromise. House Minority Leader Scott Pilath called it an embarrassment and a horrible economic decision. Today's decision allows most of the 40,000 Hoosiers now on HIP to keep the service, but will require some to get their insurance on the new federal exchanges. And most of those currently uninsured will get no subsidies to pay for coverage.
The governor is basically saying he's willing to let 400,000 people remain uninsured in this state. He's willing to tell them that their only choice for health care is to go to the emergency room, which is costly, wildly chaotic and expensive, and passed on to the other taxpayers and premium payers.
One healthcare advocate says Pence should just give in and endorse the Affordable Care Act.
I never understood why the governor insists on wanting to continue a plan that was limited in scope in the first place when we have 400,000 Hoosiers who could benefit if we fully embrace the ACA.
But Democrats say this plan will mean nothing to many low-income Hoosiers and will leave them in as bad a shape as they are now. At the State House, I'm Norman Cox, RTV6.
Under this compromise, the income ceiling for enrolling in Healthy Indiana is reduced from 200% of the poverty level to 100%. Those above that limit will be required to use federal subsidies to obtain health care policies.